Hi everybody and welcome to All Creatures Animal Hospital puppy class. My name is Gabby and I am one of the vet assistants at All Creatures. And today our topic is going to be just kind of about what your puppy needs. So I know it can be really confusing when you get your puppy as far as like what vaccines are going to be due, and kind of the process of how, we look at records and see what they're due for, when they'll need vaccines again. So I figured I would do a PowerPoint on this. I know I've talked about it before on my previous videos, but I figured I would do this just kind of as a repeat and a refresher. So what does your puppy really need? And I know it can be really overwhelming. So again, welcome to All Creatures Puppy Class, and my name is Gabby. So what we'll start off with is our physical exam. So, every time you come in with your new puppy, we do physical exams. So what does a physical exam include? And I get that question a lot. So it includes an exam of your puppy from nose to tail. So we're looking, at their skin, making sure that everything's good. There's no lesions, marks that shouldn't be there. We're looking at their teeth, their dental health, looking at, especially our puppies, making sure baby teeth are coming in correctly. Everything looks good. We're looking at their ears to make sure that everything looks good. There's no ear debris. We're making sure we're listening to their chest, making sure there's no coughing and sneezing. We've got a couple pictures here that I've gotten off of our website or our Facebook page with Dr. Linda and Dr. Mike. But, we're doing that full physical exam. So nose to tail, making sure everything sounds good, looks good, to be able to, say it's okay to give those vaccines. So that is why, it's important we do those physical exams. We do recommend them being done every 6 months. So, when you get to that 6-month mark, we try to line it up at their 6-month of age mark so that you're coming in twice a year, just like we do for our exams, or even our dental exams. We have our dental exams twice a year, so it's the same concept. It's good to make sure that we're not missing anything, especially as they get older. We're not missing any lumps or bumps, things that we can kind of prevent from getting bigger, in the future. So physical exam, is, like I said, most important. It's what we start with on your first visit. And then, we recommend those every 6 months. So as far as vaccines, it is confusing as far as, what vaccines do they get? What do these mean? There's lots of different ways that these vaccines are recorded as well. Some go by the actual name of the vaccine. So on here, you'll see that it says 4 rounds of DHLPP, which is a mix of things that we're preventing against, and some records go by their brand name. So it can be very confusing. But we are very obviously transparent. We'll go through with you, what is on your, whether you got your baby from a breeder or a store or wherever you got them from. If you have vaccine records, we'll go through, see, what has been done and kind of where you're at in your vaccine schedule. So typically vaccines start at around 6 to 7 weeks of age and end at 16 weeks of age. Any vaccines done before that 6-week mark don't count, because when puppies are born, they actually get antibodies through their mom up until they're about 6 weeks of age. So giving vaccines earlier than that, a lot of the time, breeders and stuff, they'll do that to just kind of, prevent them from getting any kind of, disease or whatnot, to set them up for success. But it really doesn't do anything because mom's antibodies are working. So it's kind of just an extra vaccine that they're getting that's not really doing anything to protect them and give them, the immune support that they need. So when we look at vaccines, if they've gotten a few rounds of Distemper, or Bordetella prior to that 6 to 7 week mark, we really wouldn't say that vaccine counts, and we'd want to start at that 7-week mark to make sure that, your baby is able to build the right, immune system to protect themselves against these diseases that we're vaccinating for, so that they have the best chance for success in life. So, this is why I like to do and have the little chart here, is it just kind of shows, so we want to start at that 7-week mark. So they get 4 rounds of distemper, which the GHLPP, that stands for distemper hepatitis, leptospirosis, parainfluenza, and parvo. So it's a 5-in-1 vaccine that they get, and again, they get 4 rounds of that. So that means that between that 7 to 16 week mark, they'll get the distemper 4 times, and we give those vaccines 2 to 3 weeks apart. So, we try to pair everything up together where, they're all lined up on the same kind of timeline, so you're not having to make multiple trips to get one vaccine 1 week and then come back a week later. We try to combine that to make it less visits for you as well. Then they get 2 rounds of Bordetella, which a lot of people relate to kennel cough, but it's actually now called CIRD in the veterinary field, which is canine infectious respiratory disease. So it protects more than just kennel cough. It does more upper respiratory stuff that it does protect against, but they get 2 rounds of that 2 to 3 weeks apart as well. Sorry, my cat is coughing behind me and it just threw me off. And then we have rabies that they get 1 time at 12 weeks of age. So the only vaccine that isn't boosted is going to be the rabies vaccine. So again, they get the 4 rounds of the distemper vaccine, which is obviously mixed with the hepatitis, lepto, parainfluenza, parvo. Some of these vaccines are done separate, so sometimes they'll just do a distemper by itself, sometimes they'll do a parvo on its own. It really just depends on the brand that the veterinary or the breeder is buying from, but these are how our vaccines come, so I'm just using this as an example. Then the 2 rounds of Bordetella and then the rabies. And then again, like we mentioned, doing these 2 to 3 weeks apart. For example, puppies are up to date with vaccines when they leave Petland or they leave the breeder. We have Petland in here because we see a lot of our puppies from there. But this is a mix of Petland and breeder. So they are up to date most of the time. It also depends on what their vaccine schedule is like. Everybody has their different schedules, but we go off of our AHA standards, which is the American Animal Hospital Association, which gives us guidelines. That's the best success to keep these guys healthy and make sure that they build the proper immune system and get the proper immune support with these vaccines. So we use their guideline of the 7, 10, 13, and 16 weeks, which is why, we have this little schedule set up. And like I said before, just because they've had some vaccines previously doesn't mean that they've had all the recommended boosters. So if you get your puppy, at 12 or 13 weeks and you're being told that they're up to date on vaccines, that doesn't mean that they're done. It means that they are just up to date from the point that they're at, but they don't technically finish all their vaccines at 16, until they're 16 weeks. So you can kind of see, we'll jump down to this little calendar. At 7 weeks, they're typically getting their first distemper and their first Bordetella, and then 2 to 3 weeks later, around their 10-week mark, they're getting their second distemper and their second Bordetella, and then 2 to 3 weeks later, around the 13-week mark, they're getting their third distemper and rabies, and then by 16 weeks, they're getting their fourth distemper. Like I said, this can vary. You may be getting some of these at 8 weeks, 11 weeks. It can play around a little bit, but this is kind of the basic guideline we try to keep all puppies at when we're doing their vaccine schedules. Once they, become an adult, they get their vaccines on a yearly basis. So all of this boostering is only done when they're puppies. And then once they're, at a year and 4 months of age is typically when, close to the time that they're due for all their vaccines, they'll come in and get their vaccines on a yearly basis. There are 3-year vaccines for the distemper and the rabies, but we do recommend not starting the 3-year boosters until they're at least 2 years of age. So that gives them, 2 years of having these 1-year vaccines to kind of build up their immune system more before you jump into getting the 3-year vaccines. And we can talk more about those at your yearly visit if that's something you're interested in. But, that's just kind of a brief kind of explanation. If you've heard of like the 3-year rabies and 3-year distemper, we don't recommend doing those until they are, at least 2 years of age. Bordetella only comes in a 1-year. There are some Bordatellas that are done every 6 months. It's not something that we recommend or, feel it's necessary to doing the Bordetella every 6 months. We found that it's efficient enough to do the Bordetella yearly to protect them. Some boarding facilities or other clinics may recommend it every 6 months. It doesn't hurt for them to get it, but it is something that we only recommend, besides the boostering portion, we just recommend getting that on a yearly basis. These are vaccines. Some of them are modified live, like the Bordetella. So, when they get the Bordetella vaccine as a puppy, sometimes they do a week or 10 days later start to develop signs of the upper respiratory, having some nasal discharge, coughing, things like that. So that is something for you to just be aware of. So if you do get a Bordetella vaccine and you do notice those symptoms, just let us know. It's typically, very easy fix. We, typically recommend doing some kind of antibiotic after you do your physical exam with us to make sure everything sounds good. But, these vaccines, some of them are modified live. And then the canine influenza is another vaccine. It is recommended, but it's not considered a core vaccine. So this is not something that we require or really, recommend on a, a yearly basis. But again, some boarding facilities do recommend doing the canine influenza. We do hold those vaccines in-house so that if that is something that you're interested in or you just want to protect against, you can definitely get that vaccine. It's just like the flu vaccine for us. It's forever changing. So there are a couple strains we vaccinate against. But as the canine influenza morphs, just like our flu strains morph, there's going to be different vaccines or possibly no vaccines at the moment for those strains. So you're only protected against so much. It's been quite a while. It's been a few years since we had a really bad influenza breakout with canines, and actually my Great Dane was one of the dogs that actually was first reported in Georgia during that scare a few years ago. But since then, it's been something that's been controlled. So again, it's up to you. I just like everybody has a preference on whether they want to do the flu vaccine or not. It's kind of the same concept. But making sure the distemper, Bordetella, and rabies are up to date on a yearly basis are highly recommended, and rabies is a vaccine that is required by law. So that is something that you have to get done on a yearly basis. And you do have to register, especially in DeKalb and Fulton County in Georgia. And they do require you to send paperwork in for that. So some of the other stuff we recommend. So if you've come in for your first puppy visit, we do recommend doing a fecal test. So a fecal test is done to make sure that we're not missing any parasites. So it's super common for these guys to have, roundworms, hookworms, whipworms, tapeworms, protozoa parasites like Giardia and Coccidia. Super common for them. It's things that, one, can be found in the environment, so maybe something that you happen to come across in the future if you end up doing a lot of outdoor activities with your pup, or if they're known for getting into stuff they're not supposed to, as well as, they can come with it, they can get it from their mom when they're feeding off of them. So doesn't mean that there's anything wrong with the dog or that it's bad that they have worms. It's just something that needs to be treated, which is why we highly recommend doing the fecal testing. Now, they do fecal testing on a small portion of the fecal matter that is sent into the lab. So sometimes when you get a fecal that's no parasite seen, and then a week later you may send out another fecal because you've started to have some issues and it comes back positive for something, it may not have shown up in that particular sample that was sent out previously but was in the system, which is why a lot of the time, whether it's at Petland or a breeder, you'll see that they start getting dewormed on a schedule prior to them even coming in or having a fecal sample done. So, they are getting dewormed and getting medications, which dewormings are just the medications that are used to treat for these parasites. But by doing this fecal, we're making sure that we're not missing anything else and we can finish their treatment. Sometimes, you get your baby when they're in the middle of these treatments of dewormings. So if, they've been picked up in the, day 2 of 5 of treatment. If we do the fecal and we see something, we can, start that treatment over to make sure that everything is taken care of. But it's common, something that I've seen. I've got my pup from a breeder, and he had some roundworms, and it's common that you see a lot of other pups get Giardia and Coccidia. So something that's just a liquid, typically a liquid medication that's easy to give. We show you how to give it, and it's anywhere from 2 to 5 days worth of medications. And then after that, once the treatment is done, we recommend rechecking the fecal, and then at that point, the fecal test should come back negative. So not uncommon. I always like to prepare, when you guys come in for your first puppy appointment, to not be shocked if the fecal comes back positive. We do even recommend deworming on a yearly basis. So even though your puppy may be really great, never eats anything they're not supposed to, gets a fecal every year that comes back no parasites seen, we still recommend doing a strategic deworming. It just kind of helps cleanse the system. So it's not something that's harmful for them. So we do recommend doing a deworming on a yearly basis as well, as kind of part of their yearly package. And then the fecal testing we do recommend on a yearly basis as well. So that's kind of something that we recommend as part of that yearly. But these are, some of the things that are done on their first visit or they've had done as far as the dewormings and stuff when you get your records from the breeder or from Petland. So the last thing that we'll talk about is preventative. So I have talked on another video about preventatives. So, just making sure that they're on a flea, tick, and heartworm preventative. I just always like to harp on that again. It's not something, we just say because we want to sell stuff. Having fleas are out there in the environment, ticks are out there, and mosquitoes, which are the culprits of spreading heartworm disease. They're out there, and especially now in this last week, we've went from being cold to rainy again to now humid and sticky. So it never stays cold enough for fleas to be dormant and for mosquitoes to disappear for a good period of time. So you need to make sure you're on those preventatives all year long. We do start you off, there's a couple different products. We either get you started with a dose of heartworm preventative called Interceptor, which is a chewable tablet, and that lasts for 30 days. And then you're responsible for getting a flea and tick preventative. Or depending on your pet size, we also do have Revolution that we give, which is a flea, tick, and heartworm preventative. That's a topical. And it dries in a couple of hours, which I love, and it's alcohol-based versus Frontline can be a little more oily, and it takes a lot longer to absorb into the skin. Those are typically our 2 products that we get started when they're puppies, and then as they get older, we recommend doing like the Pro Heart injections or Simparica, which, if you look at my previous like flea, tick, and heartworm videos, I go more into those different products, but we get these guys started on something on their first visit as a promotion dose just to get them started. So you have 30 days to kind of look into what products you want to do. If you've had pets before, there may have been certain products that you use versus if you've never had a dog before, it's overwhelming, but you have a month to do your research, to ask us questions, and then you can either continue getting the preventative from us if we have it in stock, or ordering it on our online pharmacy, and we have that available through our website, and you can get the products delivered straight to your door. Especially while these guys are growing, we do recommend getting just a dose at a time. Not getting a full 6 month supply or a year supply, because your pup may, have a growth spurt and grow out of the weight range that you purchased a full year supply of. And it's really hard, especially with a lot of our hybrids that we have now, like Labradoodles, mini Labradoodles, golden doodles, we've got mini huskies, full breed huskies, Yorkies, you name it. It's hard to guarantee what their size is going to be, because just like humans, every puppy is going to grow differently at a different rate. So until they're at least 6 months of age, depending on if it's a small breed or a large breed, I would highly recommend getting at least just a dose at a time. And then once they get into a good kind of like weight range with the product, and you can, do 3 months at a time and then eventually go to the 6 month, I would just stick to a month at a time. It's just easier, less stressful. You're not having to worry about swapping the product out and, trying to figure out how to get the right size. In addition to that, heartworm tests are something that are required to get more heartworm prevention. So heartworm prevention is a written prescription by a doctor. So it's not something you can get over the counter. It has to be prescribed by a veterinarian. So heartworm tests are done at a year of age. So as long as, by the time, we don't do heartworm tests until their first yearly. If the pet has never been on heartworm preventative, you can do a heartworm test as early as 6 months of age, but we don't do it any earlier than that. But at their first yearly, we expect them to be on a preventative every month up until their first yearly, and then we do their first heartworm test, which is typically just a small amount of blood that we draw to make sure. But we need to make sure that the heartworm test is negative before we can continue on a heartworm prevention, because it can be hazardous to be giving a heartworm preventative while having heartworms if for some reason a dose was missed, or they didn't have any kind of prevention for the first 6 months of their life, and then now you're starting on it. So a heartworm test is required. It's something that we include in our yearly package as well. So that's just something really important that not a lot of people know. Flea and tick preventative is not a written script, or at least most of them. There are some that I believe are written scripts, so pending on the flea and tick preventative that you choose, you may need that. But doing it through our online pharmacy makes it easy, because you just request it. We can pretty much produce the script on the other end of the site, and then it gets directly shipped to you, versus if you use an outside site like Chewy or something, or like PetSmart or whatever, you have to get a physical written script from our clinic to then send in to the company of your choice, which just makes it a little more complicated. I think easier is always better. So I love the online pharmacy, and they'll send you lots of deals and coupons and stuff that they have on different products. So I think that's great. But I just kind of wanted to go over some of the basic things that happen on your first visits, and kind of a little bit about the vaccines, because I know it can be super confusing, and it's a whole lot of stuff that gets thrown at you, especially if you're a first-time pet owner. So I hope that this information does help you and just kind of give you a little bit more of an easier understanding about all the things that are kind of recommended and required when it comes to having a puppy. So it just makes it easier and less confusing for you. But again, if you do have any questions, you can always call the clinic and either talk to the amazing staff there, or you can ask for me directly. Again, my name is Gaby, and I can go over, answer any questions that you may have. or set up a call to talk with you if you'd prefer. But hopefully, again, all this stuff that we recommend, hopefully this little PowerPoint helped. And I hope you guys have a great weekend and enjoy, I guess, this last weekend of summer before it gets cooler again next week. So thank you and have a